In a bid to consolidate national efforts in the fight against the COVID-19 pandemic, Ghana and private sector partnered with the government to build a hospital that could accommodate patients affected with the virus. Due to the country's lack of alternative treatment centers, coronavirus patients were treated at hospitals also hosting other patients with different diseases. But this latest development is expected to play a significant role in the fight against the pandemic. Let's have more details of that in this report.
A landmark achievement in Ghana's healthcare infrastructure. A group of private sector workers partnered the government to construct it to complement efforts in fighting the coronavirus. The construction of this 100-bed hospital started in April, just a few weeks after Ghana recorded its first cases of COVID-19.
Our designers, our consultants were designing this project while construction was going on. So you have a situation where contractors appear, a contractor appears in the morning and is actually still waiting for his work program for the day. All right, but nobody expected and worked at trying to get everything done so perfectly before we actually put in our bit to help save lives. No, not at all. That didn't happen. So, but it created quite a bit of a technical challenge for everybody.
The lack of a designated infectious diseases center in Ghana meant COVID-19 patients had to be treated in general hospitals. This posed further risks to other patients and health workers. The COVID-19 Private Sector Fund was launched to raise money for the construction of this hospital. It was built within a record 91 days and came at a cost of $7.5 million. The hospital has wards for treatment of patients with mild to severe cases of infectious diseases, triage units, laboratories, and a 21-bed intensive care unit. Patients with severe infections will be treated at this part of the hospital. There are 6 beds in each ward, and it has patient monitors that can be used to check vital signs. The hospital is set up to reduce close contact between patients and health workers.
We want the structures properly set up such that we have the properly trained professionals working in here at all times. Now, as a country, we have a store of some infectious disease experts dotted around the country. So we are expecting that as a start, some of these personnel will be drawn in here to actually direct care in terms of the clinical protocols.
The people behind this project now have other bigger plans. They plan to construct other infectious diseases centers in 3 regions of Ghana.
The facility is supposed to be the trigger for Ghana's CDC, Center for Disease Control. And that conversation is happening. The next phase for us is to actually have this replicated. But we must have proper protocols and systems in place to manage and operate this place efficiently and make it actually serve the purpose for which it was built. It's not just a hospital to really keep patients. It's also a research laboratory attached to it that is supposed to help us invest right and build the right skills for the management of infectious diseases and others.
Having achieved success with constructing this infectious diseases center, project managers hope it will also serve neighboring West African countries and boost health tourism in Ghana.
Private sectors in Ghana partnered with government in the fight against the COVID-19 global pandemic.